Our speaker tonight is Dr. Forrest Tennant. He's MD and Doctor of Public Health. He's the operator of the VRAC Intractable Pain Clinic. He's editor emeritus of Practical Pain Management and president of the Tennant Foundation. He received his medical degree at the University of Kansas, intern at the University of Louisville in Kentucky, and a residency in internal medicine at University of Texas Medical Branch, and a residency in internal medicine at the, or in preventive medicine at the University of California in Los Angeles, and received his doctorate of public health at the University of California in Los Angeles. He's a founding board member of the California Society of Addiction Medicine, and he's going to give us a talk tonight on JFK's pain story, a case of disabling autoimmune disease.
Thank you very much. Back when I went to medical school, there used to be a saying that if you understood syphilis, then you could practice medicine. Well, today I might substitute and say if you understood JFK's medical history, you'd probably be in pretty good shape to practice country medicine. Because his medical story is one that's complex, it's intricate, it's fascinating, and it's not just a story about his medical disease, but it's one about some great physicians. The one that is best known is pictured here, Janet Travell. She was the person who literally saved Kennedy's life and allowed him to run for president, and is known to those of us in pain management kind of as the mother and father of modern pain management. And I'll come back and talk a little bit more about her as we go through this, because she certainly is part and parcel of a fascinating story. I'd like to recognize, however, some other famous physicians, or at least to me. I was quite surprised to see here that you have some of my heroes, if you will, speaking for you. I have followed Dr. Maurizio Scatella's work on endocrinology for some years. Dan Claw has certainly been the person in the country who has popularized the term centralized pain. And lastly, Mike Kawicki is here from Albuquerque, who's actually been kind enough to write an article for me in the past, and his work on osteoporosis is certainly one I'd like to salute. I'd also like to salute the conference and tell you it's an honor for me to be here. Now, autoimmune disease, certainly to those of you who are the physicians here tonight, we'll find the next slide or two rather elementary. But I'd like for you to think for just a moment that John F. Kennedy had to be managed for many years without any knowledge of autoimmune disease. He was born in 1917 and died in 1963. And during that time, the whole concept of autoimmunity wasn't even known. For example, the first literary mention that I can find of autoimmunity was in the 1955 Current Therapy. And Dr. William Damashek recognized that hemolytic anemia would probably have something that he called an autoimmune process. The first autoantibodies were discovered in 1956 when autoantibodies to Hashimoto's disease was discovered. But you might find it interesting that in the year John F. Kennedy died in 1963, Dorland's Medical Dictionary didn't even list the term autoimmune disease. The term autoimmunity didn't even show up in a medical dictionary clear up until around 1965 or 1970. Even in 1965, Current Therapy said there was something called an autoimmune reaction, but no autoimmune disease. And it really wasn't until 1981 that there was a listing of autoimmunity in a medical dictionary. And Dorland's Medical Dictionary at that time called an autoimmune disease a condition characterized by a specific humoral or cell-mediated immune response against the constituency of the body's own tissues. So the whole concept of autoimmunity is rather new, and certainly it was not known in John F. Kennedy's day, and you kind of have to know that to sort of understand kind of what happened to him. But again, all of you know how these things work.